Welcome to this video, of course. This is the second clinical study we're going to look at today that's been published on the efficacy of using vitamin D or vitamin D analogues, similar molecules to vitamin D, as a treatment for COVID-19. Only the second clinical trial that has been published. So amazing, after all this time, there's been two small clinical trials. This clinical trial is small, but it does seem to be well conducted. It was based in India. And to give you the bottom line of it, if you don't want to watch this video, it looks like people that take high doses of vitamin D as soon as they're admitted to hospital clear the virus more quickly and are less prone to blood clotting complications. So that's the bottom line. It's looking like it's working, and it's consistent with other studies we've looked at and other observational correlation-based studies. A huge consistent body of evidence for the efficacy of vitamin D is accumulating. And yet so little in the way of large-scale clinical trials, so little in the way of national recommendations has changed. But let's look at it in a bit more detail. Now, this is the study itself. Short-term high-dose vitamin D supplementation for COVID-19 disease, a randomised placebo-controlled study, part of the SHADE study. This is a study that's looking at the effects of ultraviolet light on the skin. Published in the British Medical Journal, so good quality peer-reviewed journal. Now, just before we look at this in detail, that's the first article we'll go. That's the main point of this study, of this video. But just a quick whiz down other things we've looked at in the past. It's been observed that vitamin D deficient individuals have increased COVID-19 risk and mortality. More likely to die, that is that study there. Check that one out, of course. Always publish the references where we have them. The role of vitamin D in prevention of coronavirus disease, infection and mortality. Again, that's on that study. Association of vitamin D status and other clinical characteristics with COVID-19 results. Again, supporting the use of vitamin D. That's from the Journal of the American Medical Association. Immunomodulatory role and protective effects of vitamin D against other viral infections. This means that it can turn the immune system up or down to get it to the right level. So part of the problem with SARS coronavirus 2 is that the immune system is reduced, so people get it. But then the immune system acts inappropriately, causing inflammatory mechanisms and causes the lung complications and other complications that we know about. So it's immunomodulatory. It puts the immune system up and down depending on what it needs to be. So the porridge is not too hot and it's not too cold, and it's at just the right level, getting rid of the virus but not giving us these horrible inflammatory, potentially lethal complications. So that is what that study is about. And all of these are consistent studies. I haven't found one that, and I have been looking, that shows that vitamin D doesn't work. Another one here, again, I'm not going to go through all these in detail. Well, this one may be a little bit, having said that. Effects of calcifediol treatment. So calcifediol is a vitamin D analogue. In fact, I'll tell you about this now. Now, it's a bit confusing. So this study here gave calcifediol. This is the Spanish study. The Indian study didn't. The Indian study gave cholecalciferol, which is vitamin D3. Now, I just want to simplify this now. So I've just done a quick diagram here. So vitamin D3 and cholecalciferol, that is exactly the same thing. So that is vitamin D3. It's exactly the same thing. So vitamin D3 is cholecalciferol. That's what it is. But when you eat it, it has to go to the liver, because the body can't use this directly. So that doesn't go to the body cells or directly. That won't work as a direct thing. It's got to go through the liver and it's got to be processed. And it's processed into calcifediol, which is also called 25-hydroxycholecalciferol. It's also called that. It's also called 25-OHD3, which is 25-hydroxyvitamin D3. So all these are exactly the same thing. So the Spanish study gave this directly. Well, it's all the same thing, gave it all directly. So when I take my vitamin D tablets, my ordinary vitamin D tablets, when I take those, these are in this form here, D3 cholecalciferol form. But that can't go to the body straight away. It has to go to the liver to be processed, and it's processed into the active form, the calcifidiol form, or the active 25-hydroxyvitamin D form. So this is the active form. So all the same thing. So very confusing that there's so many different words used for it. Now the reason I mention that at this time is this was the Spanish study, and the Spanish study very sensibly didn't give this one. It gave this one directly, because this process, for this to go through the liver, can take up to about a week. So when I take my vitamin D tablets, they're probably not active and helping me much for 5 or 6 days. Whereas if you give that one, it works straight away. So you can see that as a preventative, we can give that, because hopefully someone's not going to get SARS coronavirus 2 in the next few days. But if someone's already sick, it makes sense to give this one like the Spanish study did. But the Indian study gave this one. So perhaps not the best choice, but it's what they gave. But interesting results nevertheless. So, but anyway, this is the Spanish study here. 50 patients treated with calcifidiol, which is the active form. So they were given that form. In the active form, it didn't have to be activated by the liver. Of the 50 patients given that, one required admission to the intensive care unit. That's 2% of patients. There was no deaths. The 26 patients who were not given the calcifidiol, the activated form of the vitamin D, 13 of those required admission to intensive care. That's 50% of them versus 2%, and 2 of them died. So that's the impressive clinical trial that we already have. That's been basically ignored by governments around the world, as far as I can see, including the UK government, although some people are working hard to rectify that. I'll tell you, I've actually been talking to David Davis, who's a British MP, and he's working really hard to get the government to take on board the evidence that we are presenting here, that is overwhelming, but so far without great effect. But we wish him well in his endeavours, of course, to try and increase the preventative dose and the government guidelines, but it's still not there yet. Anyway, that's another study. I mean, we could go on. There's loads and loads. I've just put a few more there in the notes as well, so you can see this is not me talking rubbish. Look at all these studies here that are providing the evidence. Now, getting on to today's study, which is this one, this particular study here that we mentioned. Now, thinking about the aim of this study, this is the Indian study now. Effects of high-dose oral cholecalciferol supplementation, that's vitamin D supplement, on SARS coronavirus 2 viral treatment. So what they did was they just gave the vitamin D that you or I would buy from the supermarket. Now this says it's ultra, I'm not quite sure what ultra means, but that's 1,000 international units of vitamin D. And as you can probably see on there, that equals, can you see that, 25 micrograms of vitamin D. And what the Indians did, so I take a couple of these a day, 2,000 units a day is that's what I take. I'm not telling you what to take. Some days I take 3, it depends what I'm feeling like. But the Indian study basically gave 60 of these. Gave 6, so the Indian study is giving a fairly high dose, but it's the same stuff. It's the unactivated form. Now that's what they were giving. So this is the first straightforward vitamin D intervention study for asymptomatic and mildly symptomatic SARS coronavirus 2 positive individuals. It's the first clinical trial. Now this is just appalling. This is the first clinical trial. The Spanish trial is good, but as we said, the Spanish trial used the activated form. This is just straight vitamin D3, like you would get from like we get from the supermarket, like I take. Now, interesting that, so we've got this study on vitamin D. It's been published in the British Medical Journal, and it's been picked up by one. This information here just shows you basically who's watching it. It's kind of an impact study. One news outlet, so one German news channel has picked up on this. It's been tweeted by 510, 7 views on, 7 mentions on Facebook and 2 on Reddit. Basically, this has been greeted by a wall of essentially universal silence. And yet, such an important study. Picked up by the BBC? Nope. Picked up by CNN? Nope. Picked up by NBC? Nope. Picked up by ITV? Nope. It's just incredible. It's almost like a conspiracy of silence. Now, this might be wrong, of course. It might be picked up now, but when this was published, it had been picked up by one outside German news outlet. Now, the study design, randomised placebo control, which is good. Participants were asymptomatic or mildly symptomatic, so these weren't poorly patients. But they were RNA positive, so they were diagnosed by PCR, and they were also diagnosed as being vitamin D deficient, less than 20 nanograms per mil. So these were people that tested positive for SARS coronavirus 2 and were also with low levels of vitamin D in their blood. And this is the form in the blood. This is the form in the blood that's being tested. So even though they were given the straightforward vitamin D tablets, they were testing the blood levels to see what they were doing. So that was what they are doing there. Now, just to clarify, as we've said, all of these are just other names for all this is the activated form of vitamin D in the blood. So they were giving it in the inactive form. Now, I must say, I'm surprised they were given it in the inactive form because it takes days to a week to convert in the liver. And these were people that were already they were tested positive. So they're already people that tested positive, even though they're asymptomatic or somewhat mildly symptomatic. So I'm a little surprised they did that because they didn't seem to realise this delay effect that you and me know about. But anyway, that's what they did. Now, pre-intervention baseline serum vitamin D, so testing the blood levels. Now, in the group that went into the intervention, theirs was 8.6 nanograms per mil, so very low was the average there, well lower than 20. And those that ended up in the control group, it was 5.54. That was just by random allocation, and it turns out that there is no significant difference between those two numbers. Now, this is surprising because remember, these remarkably low blood vitamin D levels were done in India, which is a very sunny country. And yet there's a very high prevalence of vitamin D deficiency because people keep out the sun. So very, very low blood levels of vitamin D there, it has to be said. 10 out of 16 participants could achieve higher levels. They wanted greater than 50 nanograms per mil. So they started on 8 or 9 nanograms per mil. And by giving the high dose of vitamin D, 10 out of 16 patients could achieve the high levels at the end of a week. Now, this is surprising. So this means within a week, most people, well, not most people, sort of 10 out of 16, had managed to convert enough of the inactive form of the vitamin D into the active form to increase the blood levels. But it would have been working more slowly than if they'd given the already activated form. Another 2 reached the desired levels of 50 nanograms per mil, but by day 14. So some of them still not reaching the desired levels 2 weeks later, which isn't surprising because of the time it takes the liver to convert the vitamin D. And yet that's what they gave. But it does show it works, but there's a bit of a delay effect. Now, outcome measures. They wanted to know the proportion of patients with SARS coronavirus 2 who became virus negative, RNA negative, before 3 weeks, before day 21. And they also wanted to look at inflammatory markers. So how quickly were patients clearing the virus was the key thing. That was the key thing they were testing. Now, in the intervention group, a small-scale study, unfortunately, there was only 16 patients, but they had 60,000 units of vitamin D, cholecalciferol. Now, they gave this in oral nano liquid droplets. Now, the reason they were doing that as opposed to giving pills like I take, I think they thought it would be absorbed more quickly. But it will go into the blood more quickly, but then it's got to go to the liver to be converted. So I'm not sure they fully understood the physiology of this, otherwise they would have given the already activated form. But so they were giving 60 of these a day for 7 days. So that's a big dose. But that's what they were giving. We're not recommending that, of course. I'm just reporting what they were given. Therapeutic target range was getting up to 50 nanograms per mil, which, as we saw, 10 of the 16 did. I would have thought that's a much higher dose than is necessary, but there you go, it's what they gave. Vitamin D supplementation was continued for those who did not achieve that level after the end of the 7 days. Fibrinogen levels significantly decreased with cholecalciferol supplementation. Now, fibrinogen is one of the clotting proteins in the blood. So the idea here is that there will be less fibrinogen, therefore there'll be less likely for blood clotting to occur. Now, it's not as simple as that, but that's the premise behind this study, so we'll go with that. And it does make sense. They didn't correlate it against clinical outcomes, unfortunately. Bit of a limited study really, but the fibrinogen levels, these clotting protein levels, were lower. 62.5% of participants became SARS coronavirus 2 negative. So in the intervention group that got this huge amount of vitamin D, 10 of them, that's 62.5%, became SARS coronavirus 2 negative at the end of the 3 weeks. The control group, slightly bigger number, who weren't given any vitamin D at all, only 20.8% of them became SARS coronavirus 2 negative. So vitamin D, 62.5% became negative. No vitamin D, 20.8% became negative. So we see that a much higher percentage in those that received the vitamin D cleared the virus in 3 weeks. 62.5% cleared the virus within 3 weeks with the vitamin D. 20.8% cleared the virus within 3 weeks without the vitamin D. And the difference there is P equals 0.18%, meaning that is a significant result. It is very unlikely to have arisen by chance. So that is the essence of what this study is showing. The patients with vitamin D cleared the virus, more of the patients cleared the virus within 3 weeks. More of them. They were clearing the virus quicker, and they produced less of this clotting protein, presumably meaning they were less likely to get the thromboembolic complications. But we don't know that. So the main thing is they were clearing the virus quicker, and that's based on this clinical trial data. So clearing the virus quicker obviously has got to be good, indicating the immune system is working more efficiently to clear the virus. Both groups, patients requiring invasive ventilation or significant comorbidities, were excluded. So these were just basically ordinary people with mild disease, is what that is saying. They kept an eye on the vitamin D level at 7 days, as we've said. And they also kept an eye on the other inflammatory markers as well. The one that did come up positive there was the fibrinogen. They didn't go through this in detail, but apparently those other inflammatory markers weren't changed. So this study could have been improved. Larger numbers, obviously, it would need much larger numbers. It could also be improved by correlating the lab findings with the clinical picture of the patients. It would probably have been better to give the already activated form of the activated form, the calcifidiol form that's already activated, because it takes some time to activate the vitamin D in these patients who are already positive or symptomatic. And as well as that, we know that giving smaller amounts on a more regular basis of vitamin D is better. So what we currently believe from various studies is that I take 2,000 or 3,000 units a day. We believe that's better than saving it all up and taking it all at the end of the week. So again, the study could have been potentially improved by looking at vitamin D as a preventative agent, but it wasn't. So there you go. Very many limitations, but basically consistent with the previous Spanish study. The Spanish study showed that patients didn't deteriorate. The Spanish study was interesting, showed that patients didn't deteriorate as much on vitamin D. This study is showing that patients on vitamin D clear the virus more quickly and make less clotting protein. And that's basically it. And isn't it just incredible and appalling that no more clinical trials have been done? It really does seem to be a blind spot, and you really wonder why politicians aren't being more clearly advised by their medical and scientific advisors, given the accumulation of evidence which we now have. And I don't pretend to be able to answer that question. I'm somewhat bemused by it, I must say. Okay, that is us for this video. Promising. Need bigger clinical trials. The big hope now is the Spanish are doing a much bigger clinical trial. I think 1,000 participants, so much more definitive information should be available soon. But all these bits and bobs that we're getting are consistent with this fundamental hypothesis that vitamin D is important in prevention and treatment of SARS coronavirus 2. Perhaps the biggest benefit being accrued by those with the lowest vitamin D levels. Just plenty of low-hanging fruit there ready to pick. Okay, thank you for watching as always.